Across the globe, one decision often separates financial stability from unexpected hardship, and that is health insurance. In a major move to strengthening universal health coverage, the Lagos State Health Management Agency, under the directive of the Lagos State Government, is making health insurance more accessible and affordable for residents, while enforcing compulsory enrollment for all public servants in the state. In an interview, the Permanent Secretary of LASHMA, Dr. Emmanuella Zamba, clarified the policy on mandatory enrollment for public servants and addressed their response to the registration process. She stated that from April 1, 2026, salary payments will not be processed for any public servant who is not enrolled in the state health scheme.
There was a circular issued in that regard by the Office of the Head of Service. I think that was about 2 weeks ago. It says that it actually will start in when they're going to pay April salaries. And there was enough time given for public servants to be able to register themselves. And I think the reason, I do not speak for the head of service, but I want to believe that part of the reasoning, because there was an enforcement team that was inaugurated on the day he made that announcement, is that you start from your own backyard. If you want to enforce, you must lead by example, so that others will now follow suit. So if we as public servants are saying something is mandatory, the government is saying that, then we too should be seen to be compliant. I want to believe that is why the head of service took that step. And thus far, public servants have been very cooperative. They have been registering. We had quite a lot of public servants already, actually.
There's a lot of benefits for this LRICO scheme, because one, when you plan for your health, you live healthy. If you don't plan, you'll be at the losing end, especially for our pregnant mothers. You know, when they are pregnant, they can walk into any of the accredited centers, to access antenatal, and then as well, when they are about to give birth, they can go straight to the hospital when they are pregnant, rather than looking for where to go because they don't have money. This scheme, the enrollment is as good as free, because what you're paying to receive services for a year.
Of course, you know that the benefits therein are enormous. One, it's about creating access for people to have quality health service and also affordable health services. It's not just about having access to quality health service, but also having health services that are affordable.
Speaking further, Dr. Zamba emphasized that the state government remains committed to improving the well-being of Lagos residents. She explained that Lagos State Health Scheme is subsidized to ensure affordability, and residents who are unable to pay at once can opt for instrumental payments depending on their chosen plan.
It is what government has put in place to be able to ensure quality of life, quality health, longevity of life for Lagos residents. And what do I mean by that? When you set aside this relatively affordable amount of money to one side, you are guaranteed of health for your family.
With the right coverage, individuals and families can access quality healthcare systems without the fear of overwhelming medical bills.